Do you know what goiter is?
No, what is that?
It's an abnormal enlargement of a thyroid gland, located at the base of the neck just below the Adam's apple. Goiter is painless most of the time, but large goiter can cause cough and make the breathing and swallowing more difficult.
Whoa. Ho ho. That's interesting. Tell me more, please.
Sure. Watch this video then.
Let's get started. We will learn the factors of causation, example of cases, sign and symptoms, and also the treatments.
Factors of causation. Different type of goiters have different cause. There are 3 types of goiter: simple goiter, endemic goiter, and sporadic goiter. Simple goiter. Simple goiter develops when thyroid gland does not make enough thyroid hormones for the body's needs. End up making the thyroid gland grows larger to make up for this shortage. Endemic goiter. Endemic goiter occurs in people in certain parts of the world. It is most common in Asia and Africa. This is due to their lack of iodine in their diet. Iodine is necessary to make thyroid hormone. Meanwhile, in the United States and other countries it is not common because iodine is added to their table salt. Sporadic goiter. In most cases have no known cause. But in some cases there is cause. The cause is due to certain drugs. For example, the drug lithium, which used to treat certain mental health conditions as well as other medical conditions. Other causes can be from autoimmune diseases, for example, Graves' disease and Hashimoto's disease. Next, is thyroid cancer. Pregnancy can be a cause that leads to goiter, as human chorionic gonadotropin HCG can cause the thyroid to grow. Lastly, thyroiditis, which is inflammation of thyroid gland.
Next we want to see the example of the real cases. First case involved 55-year-old male having large colloid goiter. He is outpatient of Department of Otolaryngology and Neck Surgery, Odessa University. The size of swelling approximately 10 × 10 × 10 cm3. Meanwhile, the CT scan showed a large cystic lesion. He had it on his neck for 2 years. Clinical examination showed that the swelling moved with deglutition without dilated vessels. It also has no enlarged lymph nodes or palpated. Therapeutic options include thyroxine, radioiodine therapy and surgery. Doctor proceed with hemothyroidectomy to remove the malignancy. Next, the second case involved 59-year-old female in Nepal having large colloid goiter with dyspnea. Clinical examination showed quite similar as the previous case, but she experienced shortness of breath with hoarse voice and hypertension. The swelling is approximately 10 × 9 × 8 cm3. Meanwhile, the CT scan showed a large heterogeneous lesion with eccentric calcifications. Doctor proceed with hemothyroidectomy to remove thyroid carcinoma besides treat with radioactive iodine. Lastly, they were discharged about a week after surgery without any complication. Next, we are going to look at the signs and symptoms of goiter. In most of the cases, the swelling is small in size and does not show any signs and symptoms. However, in more severe cases, there are signs and symptoms showing. The first symptoms is swelling at the base of the neck become more obvious than the usual appearance. These symptoms can be observed particularly during makeup or shaving. The second symptom is coughing. Along the second symptoms, the third symptoms will also appear, which is a tight feeling in the throat. Next, the patient who suffers from goiter might have breathing difficulties. They also will show another symptoms, which is difficulty in swallowing or known as dysphagia. Another symptoms of goiter is changes in the voice. The normal voice will turn into a hoarse voice. Here are some treatment and medication to treat goiter. Firstly is observation. Your doctor may suggest a wait and see approach, especially if your goiter is small and thyroid hormone levels are normal. However, the goiter will be closely watched for any changes. Next is medication. If you have hypothyroidism, levothyroxine acts as a thyroid hormone replacement. Oftentimes results shows it helps to decrease the size of the goiter. For hyperthyroidism, the inflammation of your thyroid gland, your doctor may suggest aspirin or corticosteroid medication to treat the inflammation. Radioactive iodine treatment is used in cases of hyperthyroidism. It involves taking radioactive iodine orally. The iodine goes to the thyroid gland and kills thyroid cells, which will shrink the gland. A biopsy may be needed if there are large nodules in the thyroid gland. A biopsy also taken to rule out cancer. Surgery is an option if the goiter grows too large or does not respond to medication therapy. Surgical removal of thyroid is known as thyroidectomy. Removing all or part of your thyroid gland, total or partial thyroidectomy, is an option if you have a large goiter that is uncomfortable or causes difficulty in breathing or swallowing, or in some cases, if you have a nodular goiter causing hyperthyroidism. Surgery is also the treatment for thyroid cancer. You may need to take levothyroxine after surgery, depending on the amount of thyroid removed. That's all from us. Thanks for watching.